All right, so this is for anatomy. This is the bones of the axial skeleton that you'll have to be able to name and identify. So I want to take you through them and point to them in the parts. So the axial skeleton is in the center of the body. It is pretty much, if you remove the arms and legs from the human skeleton and take off the clavicle, the scapula, pretty much what you're left with is the axial skeleton. So the skull, the facial bones, the vertebrae down to the sacrum and the coccyx, and that is including your thoracic cage, your ribs, your sternum. That is your axial skeleton. So let's start with the vertebrae. Okay, so the vertebrae go along the back here, and there are cervical vertebrae at the top, and there's 7 of those. You can start at the top and count them 1, 2, 3, 4, 5, 6, 7, and they're referred to as C1, C2, C3, etc. The thoracic are after that, and there's 12 of them, T1 through T12. And the thoracic vertebrae all articulate or form a joint with ribs. So there's 12 pairs of ribs. And so if you find the first rib here, pair of ribs, so if you can see that, right here, the thoracic vertebrae forms a joint with it right back there. Okay, so those are the thoracic. And then the lowest vertebrae are your lumbar. So 1, 2, 3, 4, 5. Those are your lumbar vertebrae. And beneath that, you have fused bones that form your sacrum here, and then your coccyx at the bottom. Okay. Vertebrae, like I said, the thoracic are articulate with a bone pair of ribs. So this is the anterior part of the human body. This is the sternum. That's part of the axial skeleton. Here's the mandibular, the body, and the xiphoid process of the sternum. The xiphoid process is of anatomical importance because before you give somebody CPR, you need to find it and then do chest compressions above that so you don't break it off, thus maybe potentially puncturing their lungs. The ribs, the thoracic cage, of course, protects the heart and the lungs underneath it. The first 7, 1, 2, 3, 4, 5, 6, 7 pairs of ribs are called your true ribs because they have a pretty much direct attachment or parallel attachment, perpendicular, not parallel, to the sternum here. And this area, why it's brown, it's because the cartilage actually connects those bones to the sternum itself. The last 5 ribs, 1, 2, 3, and then 4, 5 here, referred to as false ribs because they don't have either a direct attachment to the sternum or no attachment. All the ribs articulate or form a joint with the thoracic vertebrae, including ribs pair 11 and 12. These are known as your floating ribs because they're only attached to the dorsal side or to the vertebrae, the skeleton. Back here, let me see. Oh, I know what I'm missing. Another bone in the axial skeleton. It's very unique. It's called the hyoid bone. So it's right beneath your chin. And if we move it out of the way here, you can see the hyoid bone right there. And it looks like it's kind of floating there. It actually helps to hold up your tongue muscle, and it's attached via some ligaments or tendons in there. The face here, you can see some bones. Here is your mandible. Now your mandible is your only movable bone in your skull and cranium. And the mandible has specific parts that you need to be able to identify. Oops. So this right here is the mandibular angle right there. You have the mandibular ramus, this like indent here. The mandibular notch, mandibular condyle is where it articulates to form that joint, TMJ joint. The mandibular ramus, I think I mentioned that one, so that might be it. Over here, you see the holes. I don't know if you can see them that well on this skeleton here, but the holes in here are called your mental foramen, because this is your mental region. And these are where blood vessels go through the bones to reach the skin, to get the skin good blood supply. This bone right up here is your maxilla, and it fuses on the underside, okay, to form part of the hard palate. So the maxilla is the anterior part of the hard palate. The other part of your hard palate is formed by your palatine bone, which is up underneath, which is hard to see from this view, but you could see it from a cross section looking at the bottom side of the view. This bone right back here is the vomer bone. The vomer creates a nasal septum, which essentially divides your left nostril from your right nostril. And if you feel in there, it's a lot of cartilage, but down at the base there, that's the vomer. We also see the inferior, middle, and the superior nasal conchae. Those are regions inside your nasal cavity that are parts of different bones. The inferior is part of the lacrimal bone, and the other two are part of the ethmoid bone. The nasal bone is the bridge of your nose right here. Behind that is the lacrimal bone, and you can't really see it well on the skeleton. You just kind of know it's there. It has a different number, like 95 is the nasal bone, and 94 would be the lacrimal. You've heard of the lacrimal gland or lacrimal apparatus. Your tears, the holes that the glands of your tear ducts are right in there, and they're released, and the tears wash over the eyes that way. These are called your orbitals, and they're formed by the merger of many different bones in the skull. One of them is the frontal bone right here. And this is the supraorbital foramen, the hole at the top, and then the hole at the bottom is the infraorbital foramen. This bone is called your zygomatic bone, and it joins this bone over here called your temporal bone, which you also have on the other side. Okay, where the zygomatic bone meets the temporal bone, this is called the zygomatic process. Okay. Let me grab this. Switch over here. So we're still talking about the skull, but a different version. So we got the frontal bone. This line here, this suture, is where the frontal bone forms a joint with the bone behind it. So these are the parietal bones. There's actually two, 1 and 2. And this line, the suture right down the middle of the parietal bone is called the sagittal suture. Here's the coronal suture. In the back, okay, so here's our skull. This suture right here is a lambdoid suture. And then we have where the temporal bone right here meets the parietal bone, and that's the squamosal suture. So the sutures are essentially joints where the bones meet in the skull. We didn't talk about the occipital bone here, but that's the base of your skull. There's specific parts of the occipital bone that you need to know. This is where the spinal cord exits the brain, right? So this is called your foramen magnum. It's a large foramen that the spinal cord exits the skull. And then we have like this little bulge in the back of your head in your occipital bone. That is called the external occipital protuberance, and we have muscles that attach to that point. Other specific parts of the bones that you need to be able to name. Here's our temporal bone again, right here. Okay, this little rounded part right here, which is also an attachment for muscles, is called the mastoid process. Anterior to that, and somebody said the other day it looks like a shark's tooth. That's a good example, or a good analogy here, is the styloid process. Make sure I got all those. I think so. Inside here, and it's going to be hard to see because it's all white here, but we have the ethmoid bone, which is in there. And then you can see it over here, part of it, and over here, part of it is the bone that crosses through the head. That way it's called the the sphenoid bone, and it kind of links all the other bones in the skull together. It looks like a bat. What else? Oh, within the frontal bone, the maxilla bone, the ethmoid, and the sphenoid, we have these open little cavities within the skull. Those are referred to as sinuses, and they're there for a few reasons known to help give resonance to your voice, sounding chamber, to make your voice sound like how it's supposed to sound. It also is lined with mucous membranes to warm and moisten the air. And if you've ever had a sinus infection, you know that if it doesn't drain properly, it builds up pressure, and that causes pain. The cervical, or the vertebrae, you also need to be able to identify on their own. Okay, so we have the cervical, your thoracic, and then your lumbar, and the parts of them. The part that's on the back, okay, sticks out that you can kind of feel on anybody, really, the bony part right here. This is called the spinous process, and the different vertebrae all have a spinous process, so it'd be on the outside. The other side that holds the weight of the body is called the body, and in between all the bodies and the vertebrae, you can see here, here's a vertebrae, here's one, you have these fibrocartilage discs that help absorb the shock as the body's walking. And they do allow a little bit of bend of the spine, not total free motion, but semi-motion, little fluid movements. And we know that causes pain if that would be slipped. So back to the other parts of the vertebrae, you have the little processes that stick out. Those are called the transverse processes. You can see here. Boom, boom. And then the large central opening is called the vertebral foramen. That's where the spinal cord goes through. And then only in the cervical vertebrae, if we look at the cross section here, we see the vertebral foramen, we have the transverse foramen. That's only in the cervical vertebrae that allows blood vessels going from the heart up to the skull to go through. So I don't know how well you can see it here, but see the red here? That is the blood vessel going up from the heart to access the head through those openings. Okay, so cervical vertebrae has 3 holes, and the spinous process kind of sticks out straight. The thoracic vertebrae only has 1. And also, big giveaway here is the spinous process jets down pretty much without coming out hardly at all comparatively to the other ones. And then the lumbar vertebrae is a much larger body, and the spinous process is more rounded and it sticks straight out. And let me make sure. There's also the ear bones that you need to know about those. So there's 3 on each side of the human ear that links the outer ear to the inner ear to be able to hear. Okay, they actually transmit the sound waves. So here is our ear canal. Oops, other side. All right, and here is our eustachian tube, eardrum. And sound waves will bounce on this, and they'll be transmitted via the malleus, the incus, and the stapes, the incus and the stapes, to the inner ear. We'll talk more about that in anatomy too, but the malleus, incus, and stapes, and you can't see it that well on here, so make sure you take a look in your book and your notes, and you're able to identify those. And that is the parts of the axial skeleton and the bones of the axial skeleton that you need to be familiar with.